Hello, welcome once again to the Mental Health Hub. My name is Dr. Pamela. I'm your host, and I'm glad to host you in this episode once again, following up what we discussed last week, looking at the principles. What principally do we look out for in a program that will help restore or support somebody who is going through a mental health challenge or somebody with a mental health disorder. As we said last week, this is important for you as the person seeking help, or for you as a family member seeking help from a treatment facility or a treatment program to help a member of the family, or even an employer or a workplace that is seeking support for its people. Principally, what do you look out for? We are looking at a program that should be able to strengthen this person to restore hope and dignity to their life, to be able to give them an identity, to be able to help them understand themselves. The program should be able to focus on the issues that are presenting, or the issues that this person has. As we said last week, it should be holistic. A holistic program that looks at the physical health of the person, the mental health of the person, the spiritual health of the person, the skills that this person has, so that we can build their knowledge. It should be able to give hope, so that when you are there, you are not being looked down upon. You are being valued. It is a program in which whatever interventions that are being done are restoring the dignity of this person. Because health is a human right issue, and the right of the person to live a good life should be the focus of a program. After all, you are trying to restore the health of this person so that they can live a dignified life. So this program should be able to restore hope to the person who is unwell. It's a program where support is very key, even peer support. Because in a recovery program, usually, especially for substance use disorders or rehabilitation centers, as we know, there are other people. There may be a rehab that has a capacity of 30, a capacity of 50, a capacity of 100, if it is big enough, or large like that, and it's able to take care of such a number of people. There are peers. There are people in this program that are going through treatment at the same time. They need to be able to support one another to recover, so that they are not putting one another down. In their sharing of their experiences, in learning together, they are encouraging or supporting the person to recover. In the program, even the facilitators, the counselors, the nurse, the workers in that facility should be able to support the person on treatment. But more so for the peer support, it is very, very important, so that when they are learning and running the program together, they are building one another's skill, or helping one another to grow, not to put one down, not to make one feel like they are more of a misfit. But they are loved, they are respected, they are regarded, they are not judged. They are not made to feel like they will never amount to anything. A program should be able to support the person to grow. As I've again said, it is important to know treatment is not a linear thing. It's not like you'll walk in and something will be fixed in your system and you recover and that's it. No, it's not linear. What do I mean? We like to use the wheel of change, whereby you are looking at a person, maybe even when they are contemplating to come for for the treatment program, there are some of them who have not even contemplated or who have not even thought of the importance of treatment. That is one of the stages. Then one is told about this treatment facility, or probably that actually you can be able to deal with the mental health issue that you have, and there is a program that can support you. It is an illness like any other. It is a disease. You can be supported. Then they start contemplating, thinking, yes, I think I need this. This can take long until then they come into the program and they appreciate the program and they start doing the program. They are active, doing the activities that they need to do, learning if it is the group discussions, attending the personal therapy, attending the group therapy. They are starting to realize that, hey, before I was not taking a shower. Now I know I need to take a shower. I was not knowing how to manage my emotions. Now I'm learning how to manage my emotions. They are actively involved in a program. Then they need to be able to maintain that pace of behavior change or working towards recovery. And as they try to maintain that and grow into it, you find that at some point, because of the maybe challenges of life, because of things that happen, because life really, the challenges don't cease because you have a mental disorder. You can find that somebody falls back to a point of a step that they passed through. They reverse the gains that they have already been made. We don't give up on them. The program should be able to remember that treatment is not a linear process. It's not a walk-in, walk-out, already repaired. It's not like there's a part of the brain that you have come and fixed, and therefore the person, you expect them to walk out a different person completely. There is a cycle of that we need to understand of behavior change and be able to appreciate that it's not a fixed thing. It's not like you are coming to fix somebody quickly and they go. And that's why the programs at times run like for 3 months, some 6 months. You find there are people who will do this program over and over again. We need to be able to appreciate that. So principally, even during treatment, you need to know it is not a linear process. It is not like you are bringing your person to a psychologist, to a psychiatrist, to a rehabilitation center, to a halfway house, or to a clinic for the therapists, for the psychiatrist to quickly fix, and you go back with your person already repaired. Remember, it is a program that may take a while for this person to be restored to normalcy. Remember, mental health, as we said, most of these conditions are lifelong, and especially when the diagnosis has not been done early, so that you find you are getting a client who has moved from to severe mental disorder. You know, when you are already bringing somebody who is already having the severe state, really you expect the same way the condition has taken long to build. It has taken long before the person starts treatment. It will also definitely take a while for this person to really become functional and become what probably as a family or as a workplace you'll really say this person has gone back to themselves. So we need to be able to appreciate the fact that the treatment programs may take long. The treatment program may require you to invest more not only in resources, but even in time for you to see good results. Again, I want to say that for the program as well needs to restore respect to this person, not only for themselves, but for other relationships that they have. Maybe respect for the family, respect for the institutions. How do we do this? By helping them develop coping strategies. Because we know that life has a lot of challenges. Life is about relationships. Life is about working with other people. And you cannot really have a people that you are always, is like we are all of us uniform. We behave the same way, we have the same skills, we have the same capacities. People are quite different and diverse. That's why we need to develop coping strategies. Why coping strategies? The challenges of life will be there. But we need to be able to build the ability of this person to manage the stresses of life, know how to manage their time, manage their resources, manage relationships, manage their health as well. Remembering that if they are on medication for a long time, and likely for a lifetime, then they need to be able to adhere to the medication, so that we are building a meaningful internal schema for this person. They are able to live with themselves, even as well as live with others in the society. They are able to cope with the issues of their lives, because the fact that you have a mental disorder doesn't make you a less important person, doesn't change the fact that you are maybe a father, a mother, a child, a student, an employee, or a worker, or the position that you hold in the society, the things that you ought to do in the society that you live in. So then how else do you get restored? Is for you to build your inner self, to be able to make meaningful life with yourself, meaningful relationship with other people. The program should be able to help you do that, so that then you are restored back to normalcy, so that you can be able to live a meaningful life. Because as I have always said, health is the most important component of a human person, and especially the mental health. And remember, as we talk about health, I've always emphasized it's not only the physical. The spiritual health of a person is important. The mental health of a person is important. The physical health of a person is important. The family health of a person is also important, because we are social beings. So principally, as we look at treatment, we should be able to have an all-encompassing kind of program that will restore one to some level of normalcy, so that then you are able to live a better life. I hope this information will help you even as you think of this person in the society, of you yourself, or this person in the family, that you can tell actually treatment works. Treatment for mental health works, so that we remove the stigma and the discrimination that there is in the society about a person who has been diagnosed or looked at as a person with a mental disorder. Let us raise awareness that treatment actually works, so that we stop losing people, we stop having people who are living low quality life because they have a mental disorder, so that we stop a situation where children are suffering because their parent, either one of them or even at times both of them, have a mental disorder, to an extent that those children feel like they are misfits, and yet they have a long life to live. Let us help our nations. Let us help ourselves to bring meaning to the life of other people, especially by ensuring the well-being of the people that we relate with, our own self well-being, so that then we are able to relate with others well and make life here on earth meaningful, so that we are more productive or functional enough, so that you feel you are optimally being utilized and are able to live a meaningful life. I look forward to another episode, to another opportunity to learn with you. My handle is down there. You can be able to communicate, to give feedback, and let us remember to share, to like, and also to subscribe. Thank you, and see you next time.